I'm Dr. Jim Auvil, and I'm with the Grady Animal Hospital, and this is Dr. Russell here, that's my chief assistant. I would like to start off first here with just a minute of conversation about periodontal disease. Periodontal disease is not just a tooth problem. It's a problem with the whole system: kidneys, liver, the well-being of the animal. The periodontal disease, which means infections around the tooth.
Dr. Auvil mentioned that periodontal disease is one of the most common problems that we see in pets. It's the most common diagnosed problem that we see overall in our pets. And the frustrating thing about it is that by far the majority of our dogs and cats are not going to give us any indication that they have a problem unless we go looking for it. And we know that their anatomy and physiology is the same as with people, so this is certainly something that causes them discomfort and pain. One of the most common signs of periodontal disease that you'll pick up on at home is bad breath. The biggest thing that you can do is just routine care. Those periodic visits to your veterinarian to have their teeth and gums examined. And then from there, oftentimes it does take an exam under anesthesia to learn more about the health of their teeth and gums. Periodic cleanings, just like you or I would get, are necessary, and we can evaluate what stage things are at, generally by examining the teeth without anesthesia. So that's one of the most common things that we'll do here are just routine cleanings and assessments under anesthesia. But we have a lot of other things available as well. Commonly we'll find fractured teeth. And depending on the situation, sometimes we'll extract or pull those teeth, but we also have more advanced treatments available too, depending on the circumstances. We can talk about things like pulpotomies, root canals. Dr. Auvil mentioned crown placements to help protect the teeth from further damage. So we've got a lot of choices and things available to us that we can offer to you depending on what's needed.
Surprisingly, the people are hesitant about it. The anesthetic is the main thing they're concerned about, and the right procedure, just the way they do in humans. You shouldn't have any problem with the anesthetic, and this is a thing that is something that you should not be concerned about as much as leaving that infection in the mouth that's working on the kidneys or working on the heart or something like that.
Like Dr. Auvil mentioned, oftentimes people have concerns over anesthetic safety. Unfortunately, to really treat most dental problems, it does require general anesthetic. But we do have a very advanced dental suite here with equipment that may not be available in all places. One of the most important tools that we have is a dental x-ray unit, a digital dental x-ray unit. And that's going to help us detect problems that we would never know are there without it. Some more advanced monitoring equipment to try and make that anesthetic as safe as we can for your pet. Heart monitors, oxygen monitors. There's a warming unit to maintain their temperature and keep them comfortable throughout the anesthesia so that they're not waking up cold. We always have IV fluids running while they're under anesthesia to help maintain their blood pressure and maintain good blood flow to their kidneys. Oftentimes our dental patients are older, and that helps to really make things safer in the long run for them. And Dr. Auvil also mentioned that, of course, we're going to recommend running some blood work on the pets before we would talk about anesthesia and make sure that there's no other problems that we need to address before we go into the dental treatment. Ultimately, we want to establish a partnership between the veterinarian and the pet owner. So the first thing that really needs to be done is just schedule an appointment for a checkup, and we can evaluate what stage of dental disease is present. And even right from the get-go with puppies and kittens, we want to take a look at their mouth, make sure that their teeth are lining up properly, that there's no problems that need to be addressed from birth, essentially, and then we can get started on the right track with home care and things that you can do at home to help maintain the health of the teeth and gums, so that hopefully we're going to prevent those problems that would cause discomfort in the long run.